Welcome back to the show. It being Mental Health Week, at the start of the week, you may recall we had a wonderful conversation with Michael Landsberg, of course, a fabulous mental health advocate, a real champion, and the founder of Sick Not Weak. And he mentioned a virtual event that he's going to be speaking at. We wanted to get more details on that event. So to tell us more about the Prescription for Care virtual event that's happening on May the 10th, I am joined by Dr. Danielle Paes, Chief Pharmacist Officer at the Canadian Pharmacists Association. Welcome to the show. It's great to have you here, Dr. Paes. Thanks for joining us, because as I said, we sort of touched on it with Michael, but we didn't go into as much detail, and that's why we wanted to have you on. What can people expect at the virtual event? What's its purpose?
Well, thanks so much for having me. As part of National Caregiver Day and the initiatives that are taking place in April and May, Teva Canada has started the Prescription for Care. And really what that is an opportunity for Canadians to really reimagine what healthcare could look like. And so the initiative includes a podcast series, a national online survey. So if you haven't had a chance to fill that out, be sure to look out for it. And really, it culminates with this virtual event happening on May 10th, and we're going to have a really, really great conversation where I will be representing the pharmacist, and so helping to highlight how valuable your pharmacist can be. And the initiative also includes a caregiver, a physician, a nurse, and a patient, and we're going to bring all our perspectives together, all our viewpoints, and really think about what the future of healthcare can look like. And I think it's such an important opportunity for all of the viewers to participate, have a say.
Dr. Paes, let's talk about your perspective, because you mentioned, that pharmacists do play a role in our healthcare system. What greater role do you think they can play to help our healthcare system?
Well, I think we can all say over the last 2 years during the pandemic, the role of the pharmacist has really evolved. We've always been accessible. We've always been healthcare providers that you can see easily and conveniently. But when it comes to COVID, we're starting to really explore the idea of new services, new and expanded role. We're seeing access to screening and immunizations, and probably in the next little while we're going to see a prescribing for minor ailments, common ailments. So there's so much that your pharmacist can do beyond just dispensing medications, which is what I think the traditional view has been. And as we start to think about the post-pandemic world, I would really encourage your viewers to make sure that they've got a family pharmacist. We've got family physicians as part of our team, but pharmacists are great resources in terms of helping manage your medications, but also manage misinformation. We're living in a world where there's so much information, and Dr. Google's doesn't have a medical degree or training, so go talk to a reliable source of information.
It's a good point, and I think we need to become better advocates for ourselves. As a pharmacist, you've probably seen that, right? Where patients are coming in and they're more knowledgeable, and at the same time they need to become more knowledgeable, because our healthcare system, it seems like, it's this 15-minute visit, and you've got, 3 or 4 things you want to take care of. Is that something you encourage, people that you speak to in your industry to become better advocates for themselves?
Yeah, absolutely. I think patients and caregivers, you're all part of the team. One of the way that I practice, and my practice is in a pediatric setting, and so we have, it's very natural to have conversations with the care, like mom and dad and siblings. And so I would say that as a healthcare provider, I look to my patients and the caregivers to bring their expertise to the table, and we can be partners in navigating the healthcare world together. And we incorporate your values, your perspectives, some of the limitations, because it's going to look different for everyone. And so I would definitely invite patients to advocate for themselves. Come with all your research and have a conversation. We can figure out if it's you're going in the right direction, or if maybe there's some alternatives to explore.
Yeah, very important. Thank you so much for joining us. Remind everybody at home, tevacanada.com. You can find out all the information. Thanks for watching. We'll see you next time.